So good afternoon, everyone. My name's Natalia, and I will be your host for this session. So if you've joined us throughout the day, you will have seen all of our amazing sessions, and we still have 2 before the end of the day. So if you're interested in joining our final session, which is after this session, please do sign up on our website. In this webinar, you will hear from staff across our science courses, and they'll be sharing some of the highlights of their course, and also will be preparing to answer any of your frequently asked questions at the end of the session. So do use the question box and do send us in your questions about the course. This is the best time to ask them and prepare for September. If you've submitted an application but you're awaiting to hear the outcome, unfortunately we will not be able to comment on any individual applications during this session. But if you have a question about the course or the content of the course, please do send those questions through. So I'd now like to introduce our esteemed panelists for this session, and I'd like them to join me on webcam as well. So we have Emma Baker, Professor Emma Baker, who is our Clinical Pharmacology Course Director. We have Martin Bucknell, who is our Healthcare Science Admissions Tutor. We also have Dr. Yao Ohini Ubakwa, who is our Biomedical Science Admissions Tutor.
Hello.
Amazing. So I'd now like to pass over to Martin Bucknell, who is our Healthcare Science Admissions Tutor.
Hi, good afternoon and thanks for joining us. As Natalia said, I'm the admissions tutor for the Healthcare Science programme, and my background is as a respiratory sleep physiologist in the NHS. Today I'm going to talk about the curriculum, the clinical placements and the prospects for when you graduate. Okay, so the curriculum we deliver follows a curriculum designed by Health Education England, and we're accredited to deliver this, leading to recognised professional registration with the Academy for Healthcare Science or the Registration Council for Clinical Physiologists in both cardiac physiology and respiratory sleep physiology. And the course offers an exciting blend of both academic learning together with high-quality clinical placements. The specialty modules we deliver in cardiac and respiratory sleep physiology are undertaken by full-time clinical physiologists who have many years working in NHS in their specialty. Additionally, because we're linked to the medical school and to the university and to the St George's NHS Trust, clinical sessions and academic teaching is delivered by expert clinicians, researchers, scientists and other experts. And we are the only university in London and one of only a few in the UK offering both the cardiac and respiratory sleep programs. So as students, you'll get a chance to experience both of those before you make your final decision on how to specialise. In the final year, you'll undertake a comprehensive final year research project, and some of our students go on to publish and present their work at national and international conferences, and this lays the foundations for exciting research futures. I'm also pleased to say we've scored 92.3% on our recent national student survey. This is a survey where our final year students rate the course on areas such as teaching and assessment, learning opportunities, academic support, course organisation and overall satisfaction. For our clinical placements, there's a total of 50 weeks of clinical placement in NHS cardiac and respiratory sleep departments, 10 weeks in the first year of the programme, 15 weeks in year 2 and 25 weeks in the final year. And as students, you will be involved in direct patient care, performing and interpreting a wide range of diagnostic tests, but also involved in the treatment of patients. Year 1 is a mix of both cardiac and respiratory sleep placements. And as I said, students then get to choose their speciality for year 2 and year 3, where they can develop further clinical skills and academic learning. A big advantage of studying at St George's is access to high-quality clinical placement sites. Many of those are tertiary centres in and around London, where we have experienced mentors, trainers and assessors to support you. Examples of our placement sites include St George's, the Royal Brompton, King's, Guy's and St Thomas's, Imperial, Great Ormond Street Hospital, and many, many more. And the pictures at the bottom just show some of our students in action. As you can see, they're interacting with patients and they're performing and reporting a wide range of diagnostic tests. And our career opportunities graduate prospects, the majority of our students, about 90%, go on to apply and work as healthcare scientists in cardiac or respiratory physiology departments, and many students get jobs prior to graduation. Most students are successful at gaining places on highly competitive master's programs, including STP or scientist training programs, and some students do go on for graduate entry in medicine. I just want to leave you with a couple of our students. On the left-hand side, we can see Molly. She graduated 2 years ago with a first-class degree. She's now working as a senior physiologist at Great Ormond Street, where she did her placements. And she's also presented some of her final year project work at national and international conferences. And on the right-hand side is Rowan. He's the one throwing his mortarboard in the hair. He graduated last year and he's now working as a respiratory physiologist at a senior level at the Royal Brompton Hospital. I will end there, but I look forward to welcoming you to come and study at St George's, and I welcome your questions. Thank you.
Amazing. Thank you so much, Martin. I'd now like to pass over to Emma, who will be able to tell you about our clinical pharmacology course. And as Martin said, please do send in your questions.
Thanks, Natalia. Good afternoon, everybody. Firstly, I'd like to really congratulate you on working so hard to get good estimated grades for or good adjusted grades for your entry into university. It's been an unbelievably difficult time for people of your generation, and we can't wait to welcome you to university to try and put that right and give you a great experience here at St George's. My job is to tell you briefly about our clinical pharmacology BSc. I can actually talk about this all day, so I've been restricted to giving you 3 highlights in 3 minutes. So I'm going to tell you about our exciting content, let our satisfied students speak for themselves, and tell you about the great career prospects that this degree can bring. Let's look first at the content. Those of you who've been following the news will have seen on the back of this awful new disease of COVID-19 that we have, will have seen all sorts of new news about new drugs being developed to treat people who have the disease and new vaccines being developed to prevent people from having the condition and hopefully allowing society to get further back towards normal. Those processes of identifying and developing new drugs and getting them through for use in healthcare to treat patients, that is clinical pharmacology. So you can see it's a great time to be coming into this field. If you come to do our course, you will develop both knowledge and skills that will make you highly competitive in the job market on graduation. The sorts of things you'll learn about is, first of all, you'll learn about the human body, the biology, what can go wrong in disease, that's pathology, and you'll learn lots about drugs, how they work and how the body handles the drugs, and then putting the two together, how drugs can be used to treat disease. Our course is very, very applied. So as part of the course, you'll learn all about the processes of drug development, how trials are designed and delivered and analysed, and you'll learn all about how drugs are used in healthcare. On the right, you can see that our students are doing loads of different skills. So our course is about 1/3 lectures, which are interactive, but 2/3 are hands-on stuff. So the top left-hand box shows students taking blood already in their first term at university. They're learning clinical trial skills, the sorts of things that doctors do, but in the clinical trial scenario. Top right, you can see a student doing laboratory experiments to understand how drugs work. And at the bottom, you can see students handling data, working in teams. So loads of skills in our course and lots of hands-on exciting content. This is a busy slide with lots of writing on, but I basically used it because I thought I'd let our students tell you what they think of the course. So we asked our current first year what we should say to our offer holders to encourage them to come and join our ClinPharm family. If you look at the group of comments, you'll see the top group confirms a bit about what I was talking about. It's a very varied course. There's lots of variety, lots of breadth, lots of different learning methods, lots of experiences and integration. And for example, hospital visits, pharmacy visits. It is a new course, and so it stands out for employers, and it's in an area that employers are particularly interested in recruiting from, and I'll tell you about that on the next slide. But there are diverse career options, and we give our students early exposure to those so they can work out what they want to do after their degree. And at the bottom, you can see that our students feel that it's a well-taught course, well-organised, most importantly, fun, well-supported. We have a small course team that is passionate about making sure our students have the best possible experience. So what about prospects? I've spent the last few weeks talking to employers from across industry, academia, healthcare and regulation to talk about what they want in a student on graduation. The aim of our course is to produce students who are ready for work or further study in drug development or research. And our skills package, as well as some work experience, research projects and other things that are part of the course, will make sure that our students are highly competitive in the jobs market in a field which, as I've explained, is a growth field of drug development and research at a time when other job prospects are shrinking. And so there are great prospects, but I'd just like to finish by saying that I know a lot of people who may be thinking about clinical pharmacology have perhaps been really disappointed because they didn't get their offers for medicine. And I would say that although this course doesn't have a track into medicine, it is a fantastic preparation for graduate entry medicine, and the skills that you'll come out with at the end of this course will make you highly competitive in your application for that. And if that is something you no longer want to do, you still have the whole range of possible career options that you'll be prepared for by this degree. So I really hope to see you at St George's sometime soon, and very happy to answer any questions you might have about the degree. Thank you.
Thank you, Emma. I'm now going to pass over to Yao to tell us about biomedical science.
Hello. I would like to welcome you all this afternoon, also to congratulate you for your offer to Biomed. Biomed in St. George's has got a flexibility and especially in year 3 particularly. Our campus is shared with one of the largest teaching hospitals in the UK, which means that clinical staff are involved in teaching and research, and there are opportunities for students to get experience in NHS laboratory. In the first year of the course, you will cover fundamental aspects of cell and molecular biology, genetics, immunology, physiology, and pharmacology. And most importantly, you will learn anatomy through demonstrator-led whole body prosection. In the second year, you will cover investigation of disease processes, diagnosis and treatment. And this will cover clinical biochemistry, clinical immunology, and hematology. Your lectures are also supported with small group teaching sessions of 8 students and also laboratory practical sessions. At the end of your second year, you have the opportunity to opt for a 4-year MSci program. It has an eligibility for student loan, and our MSci program is the only course in London. In the third year of your BSc, there is a flexibility and specialism with the opportunity for you to focus on one of 9 specialisms that prepare you for a career in healthcare, in industry, in the postgraduate studies like PhD, or also to go on further if you would like to study medicine. As part of your intensive final year project, you will work with professional research groups tackling real medical and health problems and learn how biomedical research makes a difference to lives. And in that case, you graduate with BSc Biomedical Science with anatomy, with global health, infection and immunity, or clinical bioscience. Now, I would like to tell you a little bit about a professional training year. There is also the option to take an integrated professional training year within your study. That is the end of the second year, and that can be taking place in a private industry, in a research institution, a government body, or the NHS to further develop your knowledge, your practical skills, and also increase your employability. At the same time, that also help you boost your CV. You also have the Erasmus scheme, which is the European Region Action Scheme for the mobility of university students. This allows you the opportunity for 1 year of your MSci to work in an European institution, or it's also an opportunity for some summer placement in all years of your BSc or the MSci. Now, our biomed course also has a career advice which is embedded in the teaching of our teaching. Some of the areas that you can have your PTY or the professional trainee here includes the AstraZeneca, Johnson & Johnson, Glasgow, the GSK, Pfizer, and also with the Erasmus scheme, you can also go to Granada University in Spain or Radboud University in the Netherlands or the Barcelona University. Now, job prospects. What can I do with biomed? A variety of things that you can do with biomed. There are a variety of career opportunities. Many of our students progress into further studies or to scientific research or go on to do medicine. Here, if you can see this, some of our graduates, one went to work with as clinical research senior site manager at Pharmaceutical Research Associate Health Science. And a student also working with KPMG, completely not doing something, nothing to do with science. And then also some of students going on to do postgraduate studies, PhD in Washington, and these students also doing a PhD in St. George's. We have some of the students also going on to do postgraduate studies at the Physician Associate Studies, which is offered in St. George's. And last but not the least, a lot of our students also go on to study medicine. And we have the transfer to medicine in St. George's that at the end of your second year, if a student wants to do medicine, they can transfer to medicine if they are able to get an average mark of 66%, where they will be offered an interview to be able to transfer into medicine. I will leave you here, and if there are any questions, I'll be happy to answer your question. We'll be happy to welcome you to St. George's this year. Thank you.
Thank you very much, Yao. It's great to hear those highlights about biomedical science. I'd like to welcome the panel back so that we may answer some questions. Before I do open the floor up to questions, I think it's important to mention that at St. George's, we've been working hard to find ways to teach our courses without disruption, whilst also keeping our staff and students safe and ensuring we follow government guidance on COVID-19. So we won't be making any significant changes to the content of our programs, but there will be some changes to the way they are delivered. All undergraduate students will have some essential face-to-face teaching throughout the first term, with the majority of teaching taking place online. You can read more information about those changes on your course page under the tab COVID-19 Updates. So please do send in questions. We've still got some time, before the end of the session, and we really want to hear from you. We have had quite a few questions in. So the first question is, how does the clinical transfer work? Which I think you mentioned, Yao, during your slide, but maybe you want to go into a bit more detail.
Okay, the clinical transfer works in this way. Students are expected to get an average mark of 60% or above at the end of their second year. So first, second year score should be a minimum of 66%. Students who get that score are eligible to apply for the clinical transfer. And then they offered an interview. So the interview process, all the students that have 66% or above will go through an interview process. Now, if you are successful at the interview, then you have an offer, which will be a conditional offer, that you go on to finish your degree, but you have to achieve a final degree of 2-1. So achieve your final degree of 2-1 after completion, then you join the graduate entry program in the second year. So you have another 3 years of medicine. So you do 3 years biomed and 3 years of medicine. That would be total of 6 years.
Amazing, thank you very much. So I think next one would be for you, Martin. When do I choose, between specialising in the two streams of the healthcare science course?
It's a great question. Thanks for the question. As I said on my talk, students get to experience both, and that's unique to St George's as a London university. So students will go out on placement for 10 weeks in year one, and they'll do placements in both specialities, cardiac and respiratory sleep. And at the end of the academic year, when they've experienced both, they'll be asked to simply choose which area they would like to specialise in. We do complement that with a session as well to give students more detail on the course structure, on the career structure. And this year we're planning to build in some of our alumni to help that decision, because sometimes it's quite a difficult choice for students, but it's great to have a choice, and some universities don't give a choice.
Oh, that's really good to know, thank you. So we've got another question here. Are lectures filmed so we can go back to them and make notes? So I'll pass that over to maybe Emma first to answer.
Another great question. It's obviously a really worrying time to come to university when there's been a pandemic and that teaching is going to be changed. At St George's, we have a universal policy that all lectures are recorded and made available to students so they can listen back to them. But we go further than that. We have a online policy for courses where they should be trying to make their teaching more interesting and interactive than just a recorded 40-minute lecture. So, for example, in clinical pharmacology, we might have mini lectures, mini lectures, podcasts, quizzes, worksheets, things to do, so the learning is active, not just listening back to recorded lectures. But yes, everything that we do live is recorded, so you've always got it as a reference. And also, so if you're a night owl and you'd rather study at 2 in the morning, you can listen to me ranting on at 2 in the morning instead of at the time I'm actually doing it.
Great, thank you. Yao, do you have anything to add to that about biomedical science? Or
I think what Emma said, we have just like what Emma said. The only thing that I just want to add is the practicals, and as are entitled to attend practicals, we have to ensure that you attend all practicals. But if for any reason you can't attend practicals, then you have to let the course science administrator know in advance, and then we will organize the time for you for practicals, maybe like a receipt.
Yes, Emma, yes.
Thanks, Jo. I'd like to add to that as well, in that we recognise that some students won't be able to come on site, for example, if they're shielding or if they have family members that are shielding. So our plan for our practicals, as well as obviously we want students there, because we do actually really, really want to meet you guys and see students face to face. But our plan is that we don't want you to be disadvantaged if you can't come. So we will try and give you as much of the practical experience as we can by allowing you to work through the methods and the results online or at a safe distance in a tutorial, but then get the practical skills experience at a later date when you can safely come to the campus. So you won't be disadvantaged if you can't make it to the campus.
Great. And Martin, do you have anything to add?
Yeah, again, all of our lectures are recorded. It's a great resource. People have different learning styles. But just to add on as well, when we do come back to face-to-face teaching, if a student can't attend a session, for example, they're unwell or their train's being cancelled, there is that resource there they can go back and look at in their own time. So absolutely.
Thank you. So we have another question, and I'll pass this over to Yao first. So what percentage of the course is practical?
What percentage of the course is practical? That's a very good question. What happened with the biomed, for instance, had it not been the COVID-19, we have practicals every week. So the students have practicals every week, and that's a 3.5-hour session every week, every Tuesday. Yeah, that's every Tuesday for first-year students. And then for second-year students, every Thursday, they have also practicals. And then importantly, when you go to third year, that's in third year that you have to choose a specific flexibility. You choose a specialism that you want to specialize. You want to choose a project in an area of your interest. Then you do a 3-month solid laboratory work with an individual researcher. That's a one-to-one with a researcher in a lab for 3 months. So, I mean, for regard to practical, a lot of practical involved, and there's also interaction with clinicians or with researchers within St. George's.
Amazing, and I'll pass that over to Emma now.
Thank you for giving me the chance. Loads is the answer. I can't give you an exact percentage. Again, like Yao, it changes through the course. So in first year, in general, there is a lab or a clinical skills practical every week. And there are lots of other things like workshops, meeting people in the workplace, going for visits, hands-on computer workshops, doing data analysis all the way through the course. So only about a third is lectures. Going into second year, the first semester is similar to first year, but the second semester is all practical. So half of the semester is a hands-on research project, as Yao explained, with a clinician or a scientist, and then the second half of the semester is a work experience placement out in industry, a whole range of opportunities. Going into third year, by the time you get to the end of our degree, you will have competence in clinical trial skills, laboratory skills, and data handling skills, and a certificate to prove it, to show to employers. So loads of practical stuff and hands-on learning.
Amazing, and I'll pass over to Martin now.
And again, rather than practice skills, just really emphasize the clinical skills, where you will spend 50 weeks out of a 3-year program out on clinical placement, working as part of a team, performing diagnostics, and really making a difference to the quality and management of your patients. But we also internally, we do some clinical skills sessions in small groups. It's a safe environment where you can learn some of the basics of tests such as ECG, spirometry, pulse oximetry, and get to know your colleagues on the course as well. And we also do some sessions around professional behaviour and communication skills as well, because you'll be talking to patients, you'll be gaining consent.
Thank you. So, Martin, you mentioned placements actually. So we do have a question on what placements or work experiences do you offer on each of the course. So I'm just wondering if there's anything you would like to add about placements.
I think really just to say our students really love going out on placement. They love work, and really combining this academic study with placement. And our placement sites really love having students. In fact, placement sites go on to employ some of their students. So
fantastic. And I'll pass that same question over to Emma.
Oh yes, thanks, Natalia. So we do have placements in the second year of our course that are in industry, and I'm unbelievably excited about this because clinical pharmacology, this drug development stuff, is a massive skills gap, and employers can't get people to do the jobs that they want them to do. So they are really excited that we now have the UK's first BSc in clinical pharmacology at St George's, because they see this as a pipeline into this field. So they are falling over themselves to offer placements out in industry to experience some of these things firsthand. And we anticipate that that will start relationships, for example, mentorships with employers, and that as they do in Biomed, we have the option for a professional year between years 2 and 3 of the course. And that's where you would take a year out of your studies, go and work for industry, for example, a pharmaceutical industry or a contract research organisation. You'd be paid for doing that. It would be you'd get a salary for it, get loads of experience, come back and finish the course. Students who do that tend to do better. And additionally, they've created a relationship with their employer and are much more likely to get to stand out, for example, when they're looking for someone to come and fill that position. They already know you, they know your strengths and hopefully not too many weaknesses. And so they'll be looking for you to come and fill that post. So placements and relationship with industry and employers is a really important part of our course.
Amazing, thank you. And now, of course, you mentioned the professional training year. Would you like to add anything about placements or work experience for the biomedical science course?
Yes, I think Emma just said most of them, but again, the placement for that's the professional training year. That's an optional it's optional for students who come after second year. What we do is that we look for the places or the placement for the students. All they need to do is to apply. And there are a whole lot of areas, research areas, industries, NHS, hospitals, and the students who apply, they have to go for an interview and then they go to the placement. For 1 year, I must mention, some of them might be paid, others might be non-paid, but they can range from about 10 to 20,000 pounds per annum. And it's apart from the financial benefits, the students also they develop a lot of skills. Their employability is also increased. It boosts also their CV, and also according to research, even the students who do the professional training year, when they graduate, they earn more than students who have not done professional training year. They've got experience, so they enter into employment with more experience. Yeah.
Amazing, thank you. So we've got a couple of questions left, but do send any final questions or burning questions you have into us. So our next question is, what can I do to prepare for starting in September? And I'm going to pass that over to Emma first. Okay.
So first of all, give yourself a big pat on the back and have a break and a well-deserved celebration and a bit of a holiday. So that would be my first recommendation. Then make sure you've got some sort of laptop and a good internet connection for all the online stuff, and start packing if you're going to be coming to the campus. Otherwise, in terms of preparing for your learning, it's good to be perhaps refreshed. All of our courses require you to be good on biology. If you haven't done a biology A-level, starting to read about how cells work, a little bit about how the body works, and don't do too much work before you get here, because we've got loads of preparation and introduction and stuff for you. So I think probably number one, relax, celebrate and enjoy yourselves.
Amazing. I'll pass that over to Martin now.
Absolutely, and I agree. I totally agree with Emma. Just relax for a few weeks. It's been a stressful and challenging year for all of us, and I guess as A-level students, it might have been a challenging few days as well. My advice would be one, to relax. If you did want to do some reading, I would perhaps suggest you just had a quick read up on perhaps things like teamwork, professional behaviour, or perhaps just watch a few YouTube videos on some common cardiac and respiratory tests like ECG or spirometry, just to get you back in the mood for doing a little bit of work, really. But I think really, relax, come to St George's. We've got plenty of work for you to do once you start, but I think then start to grasp the opportunities and start this amazing journey that you're all on.
Amazing, thank you. And Yao?
Right, I think I agree with what both Martin and Emma have said about relaxing because of the stress that you've been through this year. But to also add, you want to read a little bit specifically or especially for the first year biomed. One of the modules that you do is called Fundamentals of a Living Cell. So you will want to read a little bit about how the cell structure of the cell, and then also the functions of the cell structure. I think that will help you to give you a head start when you come to St. George's, or when we start with the lectures. And unfortunately that we can't see you physically, but normally our lectures are always available and are very, very helpful. You can walk into a lecturer's office and then maybe ask them a question, and they are very always prepared to help you. I can trust that this is something that I don't think you get in many universities, because you walk along the corridors, the lecturers are always walking around, and then they are always very, very helpful to support students. But if you read a little bit, but at the same time relax, I think you'll be okay.
Amazing, thank you. And we don't seem to have any other questions, so I think that's probably a good note to end on. I'd like to thank our panel for sharing their highlights for their course today. I'd like to thank you for joining us for this session. As you can see on the slide, we've got one final session of the day. We've got our Student Life panel, which is an opportunity for you to ask any questions to our current students about student life, about accommodation, about their experiences on the course. And yeah, we hope you enjoy the session. We hope you join us for the next session. And if not, we look forward to seeing you in September. So thank you.
Okay. Thank you.